Welcome back to Made to Behold. This week we have a case study about childhood mental health, what not to do, and the role of plasmalogens in improving mental health. Stay tuned.
Made to Behold is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Behold. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
Welcome back. This week we again have my son Daniel as a willing guest. He is here for a couple of different reasons. He's been one of my sicker kids and had a lot of mental health challenges from childhood. And we wanted to talk a little bit about what didn't work, because we tried a lot of things that didn't work before we found things that did. And then to give you an update on plasmalogens. He started those recently. I've talked a lot about that the last several episodes, and he's had some great improvement. So welcome back, Daniel.
It's nice to be here again. How have you all been?
Doing well. Same as I was 5 minutes ago when I saw you.
No, really?
Yep. So first of all, I've mentioned before, I'll give you kind of my preview, and then you can jump in where your memory begins with mental health. Daniel was very dysregulated. Even in utero, it was triple flips, kicks, feet in the ribs, like just super, super active. An unusual amount. I've had other pregnancies. I know this is highly unusual. And he was pretty dysregulated from the get-go, especially as a toddler. Just couldn't stop, couldn't sleep. It was very difficult for us to get him to calm down. He was always running off, running away. In order to get him to sit and do anything, we had to almost restrain. I'd sit there with my arm around him, and we are going to read books, and we'd read books. He was very, very active. I didn't really notice the anxiety start until about kindergarten-ish, but anxiety became a big issue at that point that became more and more pervasive. Do you want to jump in, Daniel? When do you first remember feeling anxious or depressed? Did you ever not remember feeling that way?
I don't really ever not remember feeling anxious, because if you look at the behavior, the overexcitability, the manic behavior when I was very young, who's to say that really wasn't anxiety, like a physical anxiety caused by what we now know to be certain infections, because everything was constantly in motion in my head, even if it wasn't in my body. And I'm guessing when I was younger, I was constantly in physical motion to try and match what was going on in my head, you know?
That's probably a good guess. I mean, I remember we used to have to lay down with you for a very long time to get you to try to fall asleep. And I remember you telling me once, I think you were like 6, I just can't turn my brain off. I just can't turn my brain off. It was go, go, go. It did not stop. And it was a challenge from the beginning, because it was a challenge with social situations, classes, preschool. I mean, it definitely impacted everything. The first diagnosis you got was ADHD.
Yeah.
Mm-hmm.
I remember that.
So we took him to Johns Hopkins. We lived in Baltimore at the time. And he did this big, long evaluation and talked to him and declared him to have ADHD and dysgraphia, which is a fine motor issue with writing. But I remember reading about ADHD thinking, yeah, but there's more. And we tried a couple of ADHD meds, but some of them made things worse, and I don't think a single one of them really made things better. So we were kind of on to the next thing, tell people what school was like for you, like younger elementary school.
I imagine it would be like, you know, blackout drunks describe their life is. You know, I go there, it's kind of a fever dream. I get home, and, you know, it's kind of it. Like, it's not that I don't have memories of it, but it was kind of like I was too distracted to really pay attention to much of anything.
Right.
And, you know, they didn't really care about my needs, if that makes any sense. Like, as much as quote unquote schools have all these resources for those with developmental disabilities or mental health disorders, they don't really know what they're doing. We don't pay or educate school staff to a sufficient degree for it to be useful.
Right.
They can give you accommodations, but do they really understand what's going on, or even are they even patient? Probably not.
My other issue was always you had to have people asked me why I would fight for diagnoses, and it was because if you don't have diagnoses, the school will
They
not
don't
make
care.
accommodations.
Well,
Yeah,
and
if
that
you have something on paper, like that stupid thing from Hopkins that I paid $2,000 for, I carried that around for the next 12 years because they at least had to look at that and say, oh, well, they went to Johns Hopkins and they were diagnosed with X. That opens doors that wouldn't have been open. But I remember early on after that diagnosis, the first OCD type presentations where there were a lot of sensory issues, it taking us like 30 minutes to put your shoes on because nothing ever felt quite right, and having to then go and limit which shirts you could wear so the tags didn't bother you. Looking back, I think it was a big like Pans Pandas flare
mm,
when all of that started in first grade. You became very OCD about your handwriting. It would take you a long time to do things because of the dysgraphia, but because everything had to be perfectly written. I mean, you would write
my
so
hands
slowly.
my hands also shook from the medications, which was, in my opinion, the main reason I did it. If I did not go extremely slow, my handwriting would look really bad. I'm not saying that there wasn't a degree of OCD to it, but a lot of the OCD things that were presented were for like very real reasons, like being slow and methodical with some things was important, like the clothes, for example, and the shoes having to be just right. There was so much going on in my head at all times. Another distraction was like just tipping me over the edge. So things had to
Mm-hmm.
be as if they weren't really there, because that
Right.
was just another thing my mind would focus on.
Well, you're trying to control. And then
Hmm.
we mentioned, so the ADD, you were saying a counselor, who's actually a really good counselor who really thought OCD was the thing. There's definitely the generalized anxiety disorder. We read, there was a book that came out around that time that a psychiatrist recommended called The Bipolar Child. We felt like that fit because a lot of what was in there, you clicked those boxes and there was a family history of bipolar disorder. Your dad's brother had bipolar disorder, and we think that your dad's grandpa did. So that got diagnosis got thrown in
Mm.
there. What do you remember about being a kid and us trying different counselors and meds and foods and all these different things we're doing? Basically, from my point of view as a mom, so that you didn't suffer. It wasn't because I needed my kid to be some like
Hmm.
high performing XYZ. He was very clearly suffering. And the best I knew how at that time was, well, obviously his mental health is an issue. Let's find mental health professionals to do it. But what's your perspective on that journey?
So there were a lot of different thoughts. When I was pretty young, I think I just felt guilty because I didn't quite understand what was going on, but I could tell something about me was worrying you. And you had good reason to worry, but I didn't quite understand the implications of everything. And I think what really confused me is I did notice there was a degree of hostility that other people had towards you, when you were trying to get help from me, and it was very, very confusing to me. Like, they treated you like you were a bad mother, and I'm kind of like, you don't even know me. Like, why are you telling her what she should and shouldn't do? Like, we can let our children drink Monsters and eat a bunch of Oreos, and that's acceptable parenting, before bed. But, like, she wants to find out if I have a psychiatric condition and get me help so I'm not in immense pain. She's just a terrible person, I can tell. Like, it was so weird. And the sad thing was, it wasn't like this was just random strangers. There were family members who were extremely unsupportive and would say incredibly ignorant things like, have you just told him no? Like, I don't think people realize the suffering parents go through because of a population that has literally no idea how to react to neurodivergent people who don't think or fit the box that we like people to be in. Everyone likes people to fit into these nice categories that they can just file away, but when you have someone who doesn't, because developmental delays or something else, there's just not a lot of sympathy, there's not a lot of care, and as Krista was talking about earlier, unless you have something on paper that forces them to do something, they don't want to get involved. They don't want to complicate their job. They want to treat everyone the same, and it hasn't worked out for children who are normal, let alone those who aren't.
It's interesting. I remember your sister saying one year, and she's absolutely right, but she would throw fit. I think she was probably in elementary school, maybe middle school. She said, every year at the beginning of the year, we have to do all these surveys and they try to figure out what our learning style is. And then they still teach us all the same way, no matter what. And she's right. It's a one size fits all scenario. And there are some amazing teachers out there and people who are bending themselves in all sorts of positions trying to help. But I feel like the education system, just like the healthcare system, is much more a one size fits all approach. And like I said, the whole IEP thing, it's so hard to get an IEP, and it's really hard even once you have one for people to actually honor it. They were supposed to be this great innovation that would help guarantee services and accommodations, but they kind of become weaponized. It was very, very disheartening. You always feel like you're going into those meetings like you're going to a battle. And I'm not saying that there weren't good people who helped along the way, but I wouldn't do that all over again for a whole lot of money.
They treated us like we were trying to take advantage of them. When you look at what we would ask for, it never changed the requirements for the classes. You would still have to do the same things. You would just have more time to do it. It did not change anything. You're still proving that you can do it, but if you have extremely slow handwriting because your hands shake and you have all these other conditions, how is that such a hard ask to say, hey, can I have more time to do this?
Or can I get notes, typewritten notes or an outline? Yeah.
It changes nothing. So the idea that I don't even understand why you need an IEP for any of this. I feel like if anyone asks, they should just get it, because it's not changing anything.
And you're not asking for the requirements to change. No. You're just asking for help to learn. Yeah.
And part of the issue with all this is that there is an extreme ignorance even among medical professionals about mental health and what it means. Like, I think some people view mental health as being intellectually stupid, just being slow, mentally slow. Mm-hmm. And I don't think they understand that there's a difference between developmental disabilities and mental health psychiatric diagnoses.
Well, there's a lot of overlap.
Well,
but
that's true. There's a lot of overlap, and people can have both, but
mm-hmm. It does not mean you're delayed if you have a mental health condition.
Yes,
right?
And it doesn't mean, I don't know, it's frustrating because the people who should know this the teachers and the doctors are some of the most ignorant people I've met on that subject. I mean, you can attest there was a time you went in for an interview and someone assumed like you just couldn't do it because you were at the time diagnosed with something. It was a doctor that wasn't had no idea. Like, it was shocking and illegal. Like, I mean, you can't.
No, what Daniel's referring to is at one point along my journey with all this, before we figured out the root cause, I was diagnosed with bipolar 2. So bipolar disease is also a spectrum. Bipolar 1, you have that more clear-cut classical. There's mania. There can be psychosis. If you have psychosis, you are type 1, but there cannot be psychosis. Bipolar 2 is usually depression predominant. You have had at least one episode of what's called hypomania, where like elevated energy, productivity, this sort of thing doesn't respond to your typical depression sort of treatment. So I have been diagnosed with bipolar 2, and the number 2, not TOO. So I was diagnosed with bipolar 2, and I was always very open about it because I didn't think you needed to be ashamed. But when I went for a job interview, I was offered a job at a hospital, and then you have to do a pre-employment physical. And then my start date was blocked because of my bipolar diagnosis, because the doctor doing the physical did not understand that you weren't necessarily psychotic if you had bipolar disorder. He assumed that anybody who had that diagnosis was psychotic and unstable and shouldn't be in healthcare. And I had to jump through all these hoops. And it had a couple of effects on me. First of all, I was just pretty pissed off. But second of all, once I went back and I heard this doctor's story, he had a son who was completely healthy, went to college, had a psychotic break, and was diagnosed with bipolar disorder with psychosis. And that was really, even though he's a doctor, pretty much the breadth of his experience with it. And I felt really bad for him and really sad, and realized how much ignorance there is. It's just nutty. Mm-hmm. But so you had that diagnosis. When do you remember depression really becoming big? Because it was what was dominant for a while.
You know, I think it was when we started having the weight side effects from the medications, you know. I think it started to get worse then. Like, I didn't feel like great to begin with, because, let's be honest, I had all these terrible things going on in my head. Right. Ability to stop thinking, and wasn't getting good sleep because of the insomnia. But like, I feel like when the weight got worse and my physical health got worse, that's when things took a massive nosedive. And every time my physical health got worse, the depression got even worse. But my physical health got worse because my depression was bad, so it'd make poor health choices, and it'd just feed and fuel this, and things would continue to get worse. And it's like, oof. Not a great combination of things. And it was really frustrating because it's at a time when you're surrounded by people who are very immature, because you're all children trying to figure things out. And, you know, anything that's different about you gets judged pretty harshly. I was always very aware that, particularly among my peers, no one looked at me with any degree of you know. People didn't enjoy having me around, treated me like I was a weird problem, you know. They were kind of forced to be around. I
didn't quite know what to make of you.
Yeah, well, and I don't blame them for that. They were like 12, you know. Well, I guess I thought they were all morons at that time, so that kind of helped. Let's just say I wasn't a very kind person, because they didn't treat me with respect and dignity, and I'm like, I don't see why I need to pretend with you, you know. You're not hot stuff yourself. Here are all of your insecurities. The whole world knows them too. Why are you acting like any of us are just great, okay?
Well, so not chipper, no. What about, you mentioned the medicine, and obviously, if I knew then what I know now, we wouldn't have let them try so many different medications. But my best knowledge of the planet at that time was that we needed to find good counselors and we needed to find the right medicine, and there would be something that would help. But nothing really did. Tell us about your medication journey.
Trying things that might help marginally with certain symptoms. You would grow a tolerance or a resistance to the drug. It wouldn't work. They have to up dosage till they couldn't anymore. Then you had to find something new. Be in massive amounts of distress trying to find things that somewhat do anything. And you'd still have to deal with people looking at your parent like she's trying to drug you up because she's terrible. And you're like, look, man, I'm the one who wants this. I don't know what you're talking about. If you spent one afternoon in my head, you'd want this too, so shut up. It was kind of just a lot of very hopeless, long years of trying to get anything that did something. Not even provided great help, but just something, anything to remotely take the edge off. And honestly, the greater benefits I got were from counseling. Because it's like I could talk and talk and talk, and it was like I was expunging a poison that was inside me, because it was just all of these thoughts and distortions were there, and they had to get out somehow.
Interestingly, though, you during that phase, and you're still a talker. There's nothing wrong with that, but it's not like you could ever talk enough for it to all be better. Because all you wanted to do was talk and talk about everything that was going on here, like every waking minute. There were, I will say too, like we did have a couple of really good counselors, but even they didn't know quite what to make of you.
No.
Like the last one we had, who was really outstanding, and she really cared about Daniel, and she could really see he was suffering, and she couldn't quite figure it out. But she had told your dad and I that you probably were just going to have to go on disability. That was probably your future, because she could see how disabled you were by all of this, and she could see how hard you were trying and how hard we were trying, and that it just kind of seemed like a foregone conclusion that that would be it. And I just remember thinking, we cannot, this kid has no hope already. We can't pile onto the hopelessness and say, yeah, there's nothing that can be done. This is what you have to look forward to in life. For some people, that's an okay option, but it did not seem like an acceptable option to us. What's the first thing that you remember helping as far as treatment goes, other than counseling?
It's a toughie. So the first thing I think that truly helped was, I think we were taking, was it trazodone for sleep at some point? And while that was not resisted and we hadn't developed tolerance to it yet, I think that helped with sleep. Like the sleep aids,
is key.
And then there was, I think, doxepin for sleep that we eventually turned to. So, like, honestly, those things that helped induce sleep were probably the most useful.
If you can't sleep, you can't heal. And we've tried, just so you know, like CBD gummies, a variety of supplements. And again, some of them would help for a little while, but then it comes back around because it's the inflammation that's driving it all. But sleep is huge. I mean, you would just, it would be awful. The first thing I remember outside of the sleep stuff treatment-wise, we mentioned this in a previous episode, but we'll just recap before we get to plasmalogens. I remember when we started antibiotic therapies for Lyme, your rage changed, and just being astounded. Do you want to tell people about that? What was your rage like, and what did it feel like inside? Because you weren't someone who acted on it. I mean, I could tell you felt it until like boiling over, and we're always just holding it in, which is partly why you're so tired, because you were trying not to do anything damaging.
Has anyone ever been right next to a fire. Like you're very, very close to it. Now imagine you're right next to a fire and you've been in a sauna for about an hour or so. That would be about the physical, that approximate how I physically felt like I was on fire. And then to add to that, I felt like the inside of my body was being poked in every direction, like in the sense that if I was a balloon, I was about to explode. Like there was just too much, and there was no room. And there was a lot of impulsive a lot of impulsive thoughts, and that had gone on probably my whole life. The rage was somewhat new, but the impulsive, violent thoughts were constant. I just thought everyone wanted to beat the crap out of each other all the time because that's what people would do in high school and middle school and elementary school. And I just thought, look at me, I'm so good. I don't do that,
But you wanted to. Yeah.
Well, I mean, I didn't want to. I just had these impulses where I would my body would start to move and then I'd stop and I'd be like, oh, like I'd already be in motion, if that makes any sense. Like it's not like I'd have my fist up, but I'd be like, imagine my arms here. I would go like this and then I'd be like, whoa, 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 what's going on here? Most of it was I was extremely dysregulated and people were an irritant, and I don't think I put that together till much later, but I remember telling you guys this because I'd finally put it together that this was not normal. So that might be something those with children who have neurological conditions might have to be aware of. They might not be aware that what they're going through or doing isn't normal because it's all they've ever known. It's how they've existed their entire life. So wouldn't that be normal to them?
Right.
It's really rough because then you start to question, okay, if this isn't normal, am I a bad person? Do I have these thoughts and impulses because I'm just a violent, dangerous person?
Right.
It's very hard because you have to start questioning where it's coming from. And before we knew it was infection related, I could see how I would think, and maybe even other people would think it would be a moral issue,
Right. Right. Well, and then skipping ahead, we've mentioned before, so we won't touch on them a lot now, but a couple of the other things that were definite turning points. Neurofeedback was huge. We've talked about that.
Massive.
Methylene blue made a big difference. But then we did the prodrome scan, which we spoke about a few episodes ago, and Daniel's was awful. It was really bad. And he was really deficient in a lot of things, which gave me the information I needed to figure out a plan for doing this plasmalogen therapy. Prodrome neuro and prodrome glia was what I use along with choline. We talked about acetylcholine last week, phosphatidylcholine, just addressing what does his body need to be able to repair those nerves. And what I found was fascinating was within literal days of starting it, he started to feel different. So I'm going to read to you. Right now, Daniel's been on plasmalogens for less than a month still, but he and I made a list over the weekend. I'm going to read to you the things that he's noticed. He says, mental improvements, the rusty cogs in his head finally starting to turn a bit, but started within days. Faster emotional recovery. He still has really intense emotions, but bounces back from setbacks. He's noticed greater physical endurance. Also, resurfacing emotions. He said, I feel like my emotions were blunted or non-existent, but now they're resurfacing, and it's overwhelming sometimes because I haven't felt. He notes more empathy. He feels a little more weepy and like he cares more, but he has greater optimism. He feels like he has a personality now, and said there's a person who was always there, but that he's discovering. There's more, but can you talk about that? But you feel like you're kind of finding yourself and who you are?
I didn't realize I was such a cocky individual. I was just like, yeah, look at me. I'm so great. Like, there's just a guy in me that I didn't know was super confident, super chill, and just very upbeat and thrilled about living life. And it's been very strange to see him pop out and just be like, "Hey, what's up? Aren't we cool?" And I'm like, "Who the frick are you? What are you doing?" Okay. Like, I remember jokingly telling someone, "Well, I'm basically a god," just to, because I was bragging about something. I was like, "Hey, you know," and to be fair, it was something worth bragging about. One of my professors reached out to me and said, "Hey, your work on drugs, your work is exemplary and no one else quite gets it." It's a pretty big compliment, if I do say so myself.
But you were able to, in the past, even if that would have happened, you wouldn't have been able to let yourself enjoy that moment.
No, no, I would have
You
been
know,
like, what I would have said, and this is also true, is that I have an unfair advantage. I grew up in a household with a nurse practitioner and a lawyer who prosecuted, you know, drug dealers. I have a better understanding of drugs than most people. This is true. It didn't make my papers amazing, though. And it's one of those things that I'm starting to learn, that you can look at things both ways. You can humbly acknowledge that you've had many advantages in life that have made you have greater success while still acknowledging you did something. This didn't happen accidentally. You had to get up, put in the work, and try. It's a delicate balance. And I don't know, this it's interesting to find myself because I also, we were talking about the emotions. I found that I have a lot of emotions apparently, and I have a great amount of empathy, and I all of these jumbled thoughts that I had, I'm starting to realize they were connected. I just couldn't make the connections. Like, I was talking to you, like, even last night, just about all these ideas I've had, and I could explain how they all relate to one another and how I'm jumping from this point to that point, but here's why. And before, I couldn't do that. It was like the different parts of my brain were not connecting to one another.
just
There
more
would be,
cohesion.
yes, exactly. And it's very it's very confusing because I kind of always thought I was just a bit of an idiot. But looking at how bad my plasmalogen levels were, like, some of them were 20 times less what they should be. I was literally running on fumes, and all of these things help make nerves and, help the brain function and connect and send signals. And I was already doing pretty good with nothing. Now that I'm starting to get these, and as we said, it's hasn't even been a month. I mean, just continual improvements. I will say there have been some things that might have concerned some people, but like, I've had a lot of digestion issues, like diarrhea and whatnot, which I talked to Krista about, which we think it's because the nerves are also, connected to the gut, right? Was that what you were?
Right. You said more diarrhea and gas, but that you
Mhm.
also felt like a little less inflamed and like you're actually
Yes.
digesting things
Yeah.
better. So yes, your nerves innervate the gut too. And so as all of these pathways heal, I think what you said that you attributed to emotions, I think is happening elsewhere. You said you were just feeling things more intensely.
Hmm.
And I think that might be part of that process as well.
Well, yeah. And the main reason I mentioned it wasn't to gross anyone out, but I worry some people might start these and think that, oh, I get diarrhea from this. It's a side effect. Should I stop? You know what I mean?
That's a good point because your nerves really affect motility in your gut. So if you've got gastroparesis, which is basically your gut being almost paralyzed, just moving really, really slowly, and then suddenly things fire up and these nerves are firing, things start moving a lot more quickly.
Hmm.
There can be an adjustment period too, and maybe a bit of a purging if you were backed up.
Oh,
A
yeah.
couple other things that you mentioned that I want to hit. You said if you let yourself, you're able to sleep longer. that your sleep's been a little less fractured and more restorative. And we know sleep has been huge. More able to enjoy things, more willing to take risks and try new things like new recipes. You said you felt more connected to God because you're able to focus and listen a little better. Can you tell us about that?
What I've noticed is it's not that God is not speaking to us, it's that sometimes we're so ill, so dysregulated, that we can't focus in and actually hear what he's trying to say.
Yeah.
And it's frustrating because one could say, hey, it's not my fault that I'm this way. Why would God, not help me out if he's all powerful? And I don't think we understand how much he does. For me, what I found is oftentimes when I was too ill to really hear him, he would send other people to tell me something word for word. And that's how he would answer things when I was in that state. And that sometimes we have to figure out different ways to communicate and receive answers from the Lord if you're dealing with those kinds of issues. Like depression, it's very hard to feel anything. It's not just God, and it's really hard. It's frustrating, and I think some people, the saddest part about it is they take it as God is displeased with me, or I've done something to offend him, and this is why he isn't talking to me. So clearly I'm bad, or I'm unlovable, or whatever, and it's just not the case. And it just sometimes takes perspective. I will say, you talked about being, trying new things. New things have become not really terrifying to me. Before, the lack of control and understanding would have destroyed me. A good example of this is I made a recipe, homemade sausage gravy to put on biscuits with eggs and hash browns, for the first time, and there were guests over. I had no idea if this was going to turn out well. I just had a confidence that I've made things before. I know what I'm doing. I make a lot of homemade sauces. This is going to be okay. Whereas before, I would have had to have secretly made this 2 or 3 times before I'd feel comfortable sharing it,
Yeah.
And there are a lot of other things like that where people will call me last minute and I'll just do something. Like there's just a great deal of flexibility that I didn't have before in practically every area of my life. I don't know how to describe this other than it's like most of my neurological psychiatric symptoms were caused by these deficiencies, because the anxiety's better, the depression's better, everything is more controlled and everything functions and connects better. Like the OCD significantly improved, like everything across the board. Like I had no idea, just these lack of plasmalogens, and you said they create like nerves and help with the connections, right?
Yeah, they're needed to repair your nerves. The myelin sheath on your nerves, which is what helps nerves talk to each other and conduct their signal.
And I think that's mainly what this was. My nerves could not talk to one another. They couldn't communicate, and it caused a plethora of issues.
Well, and I was talking to your dad. I think part of why your improvements have been so dramatic are first, it is because you were extremely deficient. But then I think on top of that, you had done literally everything else. So it
Mm-hmm.
was like, this is the glue that like everything's coming together. You had all of these things that had been fixed, but you still didn't have the factory up and going,
Yeah.
because they were all separate. And I think all of your work, I mean, do I wish I would have known about these sooner? Sure. But I also do feel like all of the other things have added up, and this is that like cohesive connecting thread. And you said too that you're able to make connections better cognitively, that it's easier to write papers in your college classes because it's easier to move between ideas. Can you
Yes.
talk about that?
So before, most of my ideas would be kind of like, if you've ever seen those paintings where they flick paint onto a canvas, it's kind of what
Hmm.
my ideas were. They weren't connected. You just flicked in different directions, not really sure how they relate to one another at all. Whereas now it's kind of like, if you've ever seen It's Always Sunny in Philadelphia, so there's this scene where Charlie has this board where he has all these strings to different like ideas that seem unrelated, but the difference between me and Charlie is my ideas do connect and that there is a point to all of this, but my mind still works in very strange ways that like I can see how the connections were made and explain them, but if I told you just them randomly, you wouldn't know how they connect. I guess a good example would be, so I noticed that so and so was, I don't know, let's just say depressed. And then I noticed, okay, all these other aspects of their life, and I'd make connections to different, you know, symptoms they had, and maybe I'd be like, I bet they have this. Like, I mean, that's often what happens when I do neurofeedback, is I see different symptoms, people talk about their lives, and I'm able to make connections to different potential deficiencies they may have, or just conditions they might want to get checked out that I'm they don't sound related, but like I'm able to make the connections. I mean, maybe that doesn't make a whole lot of sense, but it's hard to
Well,
explain unless it's happening right then, you know?
well, and I would say you've been very helpful to me in figuring out what's going on with some people because sometimes they're your client first or they'll talk to you in ways they don't talk to me. And
Yeah.
I will put a shout out. Daniel is our neurofeedback provider and he is accepting new clients. And one of the things we don't really have time to dive into today, but that we can do a whole episode on that plasmalogens and neurofeedback and genomic testing can all be really helpful for is addiction. And Daniel
Hmm.
did note that just with his own life, that he has fewer cravings for things that were bad habits. And even though there's still like psychological dependence, it's not the same like physical dependence on things. And so we're really excited to look at, well, what's the intersection of if we can help repair these connections through that combination of neurofeedback and plasmalogens. Because if you think about it, plasmalogens is repairing the frayed wires, right? And then neurofeedback's like the recircuiting, the rewiring of things. So you put that together. He had some great ideas yesterday about which parts of the brain we know different drugs affect so that we can target those areas during neurofeedback. And then genomics, which I've mentioned the last few episodes, they have an entire addiction panel that helps look at risk factors and what drives that. And there's a lot more to it than willpower. Just like with all of these other mental health conditions that we have, there are a lot of pieces of the puzzle. And if we can figure out what your vulnerabilities are and we can give your body what it needs to heal, things are going to be much, much easier. And we're excited and privileged to kind of be a part of doing that in a different, more effective way. He'll graduate next year with his bachelor's degree and then is planning on going on to a master's in counseling so that we can work together to help people heal in a more complete way. Because he pointed out to me when he was reading about complex PTSD the other day, he sent me a study and he said, I'm pretty sure almost all of your patients have that. And he's on to something because when you have a chronic illness and you're always in fight or flight, or you're always being dismissed by others, by the medical system, like all of these traumas that accumulate, healing's going to take a lot more than just giving you the right treatment to stop the infection. You've got to heal emotionally, spiritually, all these other things too, and learn to assess your strengths, relearn how to relate to people so that you can be whole. So we're excited to share with you more as we develop these offerings and learn, but just remember there's always hope and that you remain to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.